Tell me, babe, where are you going? Prairie wind goes on blowing. Tumbleweed shadow, I'm tied to you. Tell me, babe, what are we gonna do? 'Cause you got me in the basket, spinning and I can't tell where you get the magic.
Welcome to Better Than Ever Live, wherever you're watching or wherever you're listening. Hope you're making today your masterpiece. On today's live stream, we're going to talk about a medication receiving more and more attention as a treatment for osteoarthritis, and that's called pentosan polysulfate. We're going to look at a recent study that examines why this medication might help a patient with knee arthritis. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert, and media medical expert. I hope you feel and perform your best regardless of age, injury, or medical history. I'm still getting used to the triple board certified, so bear with me there. Please understand, as always, I am not in this live stream or really anywhere on any videos or on my website anywhere. I am not giving you medical advice in this. That's especially true here. This is meant for general information and educational purposes only. If you have comments or questions about pentosan polysulfate or knee arthritis, definitely put those in the chat, not in the comments. For those of you on YouTube, I can't see the comments. I can only see the chat. Facebook and LinkedIn, you can do what you normally do. I would really love it if you'd put your first name and where you're located so we know where people are, along with your comment or question. If you have orthopedic type questions not related to pentosan, not related to knee arthritis, join us tomorrow, 12 p.m. Eastern Time, for Ask Dr. Geier Live. Now, this is a topic that I've been excited about for a few weeks when I saw this study. So bear with me a little bit. It was a study, it was in the journal PLOS ONE, done in Australia at the University of Adelaide, which is interesting because pentosan polysulfate was mostly done in Australia, honestly. New Orleans, I'm glad to see you. I love New Orleans. That is a great town. I can't get it off the screen. There we are. So I've been wanting to talk about this for a while. The Australians were way ahead of us here in the United States on pentosan polysulfate for osteoarthritis. I've talked about pentosan before, but I've talked a lot about knee arthritis before. But I want to get into this again because it may get at a little bit of why this medication might be helpful. I know we've talked about knee arthritis, or how so many orthopedic surgeons describe it as a wear and tear process. They talk about it being similar to the tread on a tire. Basically, the tread gets thin, the tire goes bald, you need to replace it. In that case, knee replacement, metal and plastic. But that's a very incomplete model. It is very much an inflammatory condition, a situation where you have these pro-inflammatory mediators, things like tumor necrosis factor alpha, interleukin-1 beta, interleukin-6, that are thought to not only damage, their enzymes that damage the cartilage in the knee, but they also create more of these cartilage degrading enzymes. The big culprit is matrix metalloprotease 13, MMP13, very, very damaging. So what typically happens is, people try cortisone shots, which don't stop those pro-inflammatory mediators. They just make you feel a little bit better. Unfortunately, as we talked about a few weeks ago, cortisone actually does cause more damage to the cartilage and bone long term than it helps with short-term pain relief. People try things like the various hyaluronic acid injections, maybe a little bit of pain relief, certainly don't have the issues with the cartilage destruction, but probably not all that helpful. The going in and scoping the surgery and cleaning up the arthritis changes, trimming out the torn part of a meniscus for older patients has been very, very frequently shown to not be beneficial and may actually be harmful. So those are sort of your options until you get to a knee replacement. All right, we got somebody from Melbourne, Australia. This is perfect. So you'll know about pentosan. I'd love to hear your thoughts on pentosan. Mike is coming to us from Las Vegas. Definitely join us tomorrow. But glad to have you. Vegas, another great place. All right, so you get a bunch of bad options here in the United States that are probably not that helpful. If anything, they might be harmful. Then get to knee arthroplasty. And that's where potentially pentosan polysulfate may step in. And the reason that it gets from cortisone shot to hyaluronic acid, or in a different order maybe, sometimes things like platelet-rich plasma, sometimes surgery, which again, arthroscopic surgery, really, really bad idea for anybody 40 and older with knee arthritis. Some countries it's 50, 55 and older that they say you can't do it. It probably is younger than that. But the reason people end up getting knee replacement is not that you're bone on bone. It's not that your the cartilage is getting thinner and thinner or anything like that. It is pain, because you can have horrible looking x-rays in terms of arthritis and not that much pain, and vice versa. Your arthritis looks pretty mild on x-rays, and yet you've got really horrible pain. True story. I had a pair of identical twins. They were from New York, had moved down to the Charleston area. Identical twins. Both had knee arthritis. One's, though, on x-ray was much worse than the other, but the one with the worst x-ray had much less pain. So what it looks like on x-ray is just one factor, but pain is typically the main reason an orthopedic surgeon will say, hey, let's do a knee replacement. Now, why does it hurt? Cartilage cells don't have nerves, so what is going on? Well, it's more and more research is showing that there's a protein that's secreted called nerve growth factor that is largely responsible for the pain in conditions like knee arthritis. So the question that these researchers at the University of Adelaide in Australia had is, would a medication, pentosan polysulfate, which is approved for a completely different condition here in the United States, would that be helpful at blocking the release, the production of that nerve growth factor and hence decrease pain? So that's what they studied. Now, just so you know, pentosan polysulfate is FDA approved in the United States. It has been for decades, but not for osteoarthritis. It's approved for a bladder condition called interstitial cystitis. I actually just had a patient a few weeks ago that had been taking it for like 15 years for interstitial cystitis. She actually had a lot of side effects, including some eye changes. None of that applies to the way it's given to for arthritis patients. Plus, for the bladder condition, you take it as a daily drug, high dose drug. It's got a lot of side effects, and you end up taking it for a long time. It doesn't even work for arthritis that way. But where it does seem to help as arthritis is as an injectable medicine, an injection that you give yourself. And very, very promising results. It's in phase 3 trials, my understanding is, with the FDA, and I have heard that it's being fast-tracked by the FDA because it's doing so well. So I do expect that this is going to be something released probably early 2024, hopefully sooner, but it is available. A lot of functional and integrative medical practices use it. I use it. I think it's fantastic. But even that, the question is, how actually is it potentially working? There's some studies that say that maybe it rebuilds the glycosaminoglycan part of the cartilage. It may have extracellular signaling roles, namely blocking interleukin-1 beta, maybe tumor necrosis factor alpha, interleukin-6 in the chondrocytes. But again, what this study looked at was that nerve growth factor. One of the things that we know is that nerve growth factor is swirling around inside the joint in an arthritic knee. It tends to come from the bone under the cartilage, and then it's released into the joint. And so the theory, what these researchers wanted to know is pentosan polysulfate blocking the production of that nerve growth factor? So what they did is they took osteocytes, which are basically bone cells from the proximal tibia, from the tibial plateau of patients with knee arthritis and who were about to undergo knee replacement. Then they, in the lab, stimulated those osteocytes with tumor necrosis factor alpha, again, one of those pro-inflammatory cytokines, to stimulate that, and sure enough, it released nerve growth factor. What they found was that pentosan polysulfate stopped that. They basically kept the tumor necrosis factor alpha from stimulating the release of nerve growth factor. So in theory, if you, and again, it could be that it's blocking the nerve growth factor directly, the production of it, and that seemed to be part of it. It stopped mRNA production of nerve growth factor and the protein, the pro-nerve growth factor or nerve growth factor secretion, but it also did seem to stop the tumor necrosis factor alpha mediated production of that matrix metalloprotease 13. So there seems to be a lot of different roles here. I tell people that yes, it's good from a pain relief standpoint for exactly what we talked about here. It's blocking the release of the nerve growth factor, which is causing pain. But more importantly, where I feel like pentosan polysulfate is stopping the damage, stopping the effects that those inflammatory cytokines, the tumor necrosis factor alpha, interleukin 1 beta, and the matrix metalloproteases, stopping their actions, breaking down the cartilage, breaking down the bone under the cartilage. Now, is there more to it? Is it stimulating cartilage regrowth? I haven't seen a lot of evidence of that, but it's potential. What I will tell you is my patients that I have used pentosan on, I mean, I've had a few that didn't respond. That's probably true with just about anything you give any type of patient with any type of medical condition. But I will tell you, pentosan polysulfate is pretty darn impressive in terms of pain relief, at least in knee arthritis. I use it in combination with a number of different things. I think that alone is not enough. I think it's important to rebuild the joint. I think it's important to protect the structures and build the structures around the joint. But I do think pentosan polysulfate can be very helpful. Mike says, definitely great to know since I'm now at higher risk of getting arthritis in my knee. And yeah, we'll talk about that tomorrow depending on what the meniscus situation is. I will say, as far as what will be interesting about pentosan, so I do believe it's going to be FDA approved. Like I said, there are clinics in the country. I don't know many. I know two, mine and another one, but I'm sure there are others that use it here in the United States. So you could find it now, but I do believe it will be FDA approved, again, probably by 2024 if you read the clinical trial. But regardless, it'll be interesting to see how it's used. One, I think it's going to be super interesting. Does insurance pay for it? Very similar to the peptide semaglutide and what is now a drug called Ozempic. It's very, very hard to get that paid for by your insurance. And the cheapest I've heard a patient say it costed if they went to a CVS or Walgreens and just had to pay for it out of pocket is like $900 a month. I mean, it's absolutely crazy. I wonder if that's going to happen here. I hope not. I hope it's approved by insurance. It'll be interesting to see how orthopedic surgeons react in the United States react to this. Will they suggest it as a treatment, or are they just going to push people to do knee replacements? There's a lot of financial incentive, not just on the surgeon's part, but on the hospital's part, to have more and more knee replacements. And so it'll be interesting. I have heard, and maybe I forgot who that was in Australia, what Angela says. Maybe she would know. Again, can't get hers off the screen either. Really interesting. Angela, you may get to keep yours on there. There we go. It'll be really interesting because I have heard, and I have not seen this. I've looked this up on PubMed. I haven't seen it, but I have heard that Australia using this has dramatically cut their rates of joint replacement since it went in, I think like 2016, it was approved there. I've heard numbers like 40%. That would be stunning to me, honestly. But it'll be really interesting to see how this goes. Plus, at least how I think it's going to be approved, the way we use it is as an injection you give yourself, like diabetics give insulin. It's not a big deal. I've used it myself. It really isn't that hard. The biggest thing is it's thick, so it's hard to get into the syringe. But some people, that is a long step. And again, the oral form doesn't seem to help arthritis at all and has a lot of side effects. So if you have any more questions about that, leave those here in the last couple minutes. I will, that's not what I wanted. I wanted that. But if you have questions about pentosan, I'm happy to answer those. And since I did it, if you want to follow me on other social media, including getting videos like this on a regular basis, joining our live shows, getting notified when I'm on live, definitely subscribe to the video channel, click the bell, at least on YouTube, to be notified when I'm online. And I may start doing more impromptu ones, we'll see. But I definitely would love to have you join me. I talk about largely anti-aging orthopedics and trying to help people avoid surgery for orthopedics, but do a lot of health and wellness stuff as well. So tell your friends. Make sure you also subscribe to the podcast Better Than Ever Live. If you can't be here on Thursdays, you can listen to it anytime. Plus, if you'd like to see me as a patient, again, I am a triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. One of two that I'm aware of, one of two orthopedic surgeons that is certified by the American Board of Anti-Aging and Regenerative Medicine. But my goal is to help you not just overcome pain, but get back to what you love to do. I really, really believe the best way to get back to what you want to do and do it really well after one of these injuries is to do it without surgery. No surgeries, no long recoveries, very unpredictable results. And that's why I use a lot of different treatments, a lot of different medications, injections, not just to decrease your pain, not just to heal your injury, and not just to prevent it from coming back, but it's about getting you back to what you love to do, whatever your sport is, exercising every day, playing with your kids, getting through your workday, whatever it is. I want to help you optimize your performance with strength, energy, endurance, speed, muscle, all of that. I want to help you overcome your injury and recharge your body. If any of that sounds interesting, in the description below, there's a link to my website, drdavidgeier.com. Go to the contact page, fill out the thing. I'm happy to see you. I see patients in Charleston, South Carolina. It's a beautiful town. You'll love it if you're not from here. I get easily a third of my patients travel in to see me. So I would be more than happy to do that. So the information is below. If not, no worries. If you have questions and don't want to fly to Charleston, I can't give specific medical advice, but I do the Ask Dr. Geier show pretty much every Friday, including tomorrow. So join us at 12 p.m. Eastern. Very, very excited for you to join us today. I look forward to seeing you very soon on another Better Than Ever Live. I hope you have a fantastic rest of your night and rest of your weekend. Take care.